From the heart of the nation's capital, this week with ABC News Chief Washington Correspondent George Stephanopoulos, live from the Newseum on Pennsylvania Avenue.
Hello again. It makes up almost 20% of the economy, impacts every single American, and fixing health care is President Obama's top domestic priority. Congress could have its first votes on reform this week, and the president kicked off his lobbying effort on radio and YouTube yesterday, promising that every dime of his plan would be paid for.
Real reform will mean reductions in our long-term budget. And I've made a firm commitment that health care reform will not add to the federal deficit over the next decade.
And for more on this, let me welcome the Secretary of Health and Human Services, Kathleen Sebelius. Good morning. Let's begin with the bottom lines of the president. So far, he's been making the broad case for health care reform, says it's up to Congress to fill in the details. But he just said he has a firm commitment not to increase the deficit. Does that mean that the president will veto any legislation that is not fully paid for?
I think, George, he's very serious about having health reform this year and having it paid for. And what's going on right now is exactly what needs to happen. Congress is fully engaged in figuring out the details of this proposal, working closely with the president, and he's already put on the table, the president has put on the table about $900 billion, some of that savings from existing programs that we'd use to drive quality and expand coverage, and other from a proposal that we alter the minimum tax, that we go back to the deductions of the Ronald Reagan era for the richest Americans, minimize the itemized deductions, and come up with about $300 billion. So,
but the Congress has rejected them, hasn't acted on those cuts.
They haven't even started to really discuss how they want to
Well,
pay.
they made it pretty clear what they think about that tax proposal, and some say that the savings that the president outlined will be very difficult to realize as well. So I'm just trying to get a sense. You say he's very serious. If every dime of this is not paid for, will the president say, nope, that's not good enough, Congress, and send it back?
Well, I think absolutely he wants a bill that's paid for, not to increase the deficit at a time where we're looking at looming deficits. The problem is, though, we can't sustain the current system. This is not just paying for the future. It's also the fact that doing nothing has a huge cost. It's crushing businesses, it's crushing families. Our workers are less competitive. We can't sustain the system that we have right now. So the status quo is not an acceptable alternative, and Congress knows that, the providers know it, the hospitals know it. That's why people are at the table working this year on health reform.
And if it's not paid for, he'll send it back.
I don't know the details. I think what he wants is for Congress to pay for it.
I think he wants Congress to pay for it, but you're not willing to say right now, you're not willing to make a veto threat.
Well, I don't think veto threats at any point are particularly helpful. What's better is to come to the table and get something done.
How about on the question of taxes? You mentioned the president's proposal to shave those deductions for wealthier Americans. During the campaign, he was very critical of the idea of taxing health care benefits for those who have them right now. And you were quite critical when you talked to the Congress last month.
Eliminating the tax write-off, which was a component of encouraging employers to offer coverage in the first place, has a huge potential of destabilizing the private market and leaving more Americans uninsured.
But Senator Max Baucus, the chairman of the Senate Finance Committee, came out of a meeting with the president last week and said the president is willing to consider this idea. Is that true?
Well, I wasn't in the meeting with Senator Baucus, but I've talked to the president a number of times, and he feels strongly that 180 million Americans have employer-provided health care, that taxing those benefits may indeed discourage employers from offering health care to their employees, exactly the opposite of what we want to do in the future. And it would mean for many Americans that they wouldn't keep the health plan that they have and they like, the doctors that they have and they like. What we want to do is fix what's broken, and currently employer-based health coverage is working pretty well for millions of Americans. So anything we do in the future needs to build on that system that provides benefits.
But there seems to be an emerging consensus, especially in the Senate. Senator Baucus, Senator Grassley, a Republican, and others, Congressman Wyden, Senator Wyden and Senator Bennett, and they seem to think this is the way to get a lot of the savings. So again, is the president saying he doesn't want it, but he might accept it, or there's no way he's going to accept it?
Well, again, I wasn't in the specific conversations. I think what's happening now is exactly what needs to happen as they engage in writing the bills that will mean health reform this year. And that's putting some details together, and that dialogue will go on about how to pay for it. The president has proposed a payment of savings and, as you say, shaving the deductions off the wealthiest Americans. He still feels that that's a better alternative than
But he's not going to get
some
that.
other
I mean, there's just no evidence that he's going to get that. All the major leaders on the finance committees and the Ways and Means Committee have said that's not the way they want to go. They want something else.
Well, I think then, you know, that discussion will continue in the House and the Senate. But again, what we don't want to do is have, at the end of the day, a tax on benefits that actually says to employers, it's better to dump the benefits that you have. It's better to put those employees in the private market without employer-based coverage. That's a bad direction to move.
Is there a way to reform the treatment of those health benefits, the tax treatment of the health benefits, without eliminating the complete deduction?
Well, I think that's what the Senate and House members are looking at. Is there a level above which you could tax? Is there some kind of breaking point where it might be acceptable policy? But at this point, the president feels strongly that there are some other alternatives to pay for this. What's unacceptable is the status quo. And there are lots of people on Capitol Hill who feel if we just don't do anything, it will be okay. It will not be okay.
Probably the biggest
businesses and families and government.
Probably the biggest flashpoint right now is this whole notion of whether or not to have a public health insurance plan to compete with the private insurance. And that is drawing the most fire from Republican senators. Take a look.
The American people are starting to connect the dots and see these as sort of gateway drugs to the government takeover of health care.
It's like putting an elephant in a room with some mice and say, okay, fellas, compete. After a while, the elephant has taken over the room, and your only choice is the elephant.
To back that up, they look at a study from the Lewin Group, a respected healthcare group that says that if this public insurance option paid Medicare rates, 70% of those now getting private insurance would migrate into the public plan, and that would be basically, it would swallow up the private plans.
Well, I think there's a lot of dispute about the numbers that the Lewin Group used, and also there hasn't been any decision about what rates would be paid. What the president said all along is we want a level playing field, but having some competition and having some choice for consumers is a good thing. I don't think it's any surprise that insurance companies would rather have a system where everybody must buy coverage and there were no competitors. So, you know, they get 50 million new customers.
Doesn't the public plan only make sense if it actually does pay lower rates than the private plan so that it's lowering costs?
Well, I don't think you have to pay lower rates. I think what you have to do is maybe cut some of those overhead costs and have innovative strategies. What consumers will have is choice, and in lots of places in the country, absent a public option, absent some kind of competitive option, people would have no choice. There's one dominant company, and that really doesn't drive innovation. It doesn't drive much in terms of quality care, and that's really the goal at the end of the day. We know that higher costs doesn't translate into higher quality, and what we want to do is have highest quality, lower cost care for all Americans.
The political problem with the public option is that right now, at least, Republicans don't seem eager to sign on. All but one Republican member of the Senate Finance Committee has said no public option, and to bridge that gap, Senator Kent Conrad, Democrat of North Dakota, is proposing a different kind of a system, co-ops, like that would be similar to rural electric co-ops, rural telephone co-ops. These people could band together, create their own health insurance cooperative, and he says that could be the alternative, the compromise, instead of having a full-blown public plan. Is that something the president is open to?
Well, I think that the details of exactly what that looks like are still being developed, but I think Senator Conrad has come forward with a creative idea, recognizing that choice and competition are good in a marketplace, a health insurance marketplace where people have some choices and have competition to keep prices down is actually a wonderful strategy, and that's really what the health insurance exchange is about. Stabilize what we have, but also create a system where Americans can have affordable coverage. You share the risk and you move forward.
Yet you've got other Democrats like Speaker Pelosi who say that's not a public plan. Again, I'm not sure I'm going to have any more luck on this, but I am trying to figure out, when the president looks in this, does he say, I want a public plan and it must be in the final bill, or I'm open to other sorts of alternatives?
Well, I think the discussions right now are serious ideas are on the table from all sides. He has laid out pretty clearly, and I think reinforced his support for a public option to a letter to Finance Committee members. He talked about it in a radio address. He's continuing to do that. I don't think it's a surprise that the president supports a public option. Thinks choice is good, thinks competition is good. And frankly, George, it exists all over the country. State employee health plans in 30 states have private options side by side with public option. Works well. It provides some choice. It exists in children's health insurance programs. So the notion that somehow this public plan can't work and it will drive the private insurance market out of business is just not very accurate.
And he's going to insist on it?
I think he is making it clear that's a direction he thinks will be beneficial for the public and for to make sure that costs go down, and that's a central belief of his. This has to lower costs for everyone.
Secretary Sebelius, thanks very much for your time this morning.
Thank you.